Our healthcare system is broken. If you think you understand everything there is to know about the current healthcare debate, here are a few facts that may surprise you. 46 million Americans have no healthcare insurance, and over 40 million more have only minimal coverage. 44,000 Americans die each year because they have no health insurance. The people of 34 nations live longer than most Americans. We have the most expensive healthcare system in the world. We spend nearly twice as much per person as other developed nations, and the gap is growing. The World Health Organization ranks the U.S. 37th in the world for healthcare, far behind less affluent countries such as Costa Rica, Dominica, and Chile. Our American healthcare is targeted not according to medical need, but to the public's ability to pay for it. Think about that. We're the only developed nation that does not provide comprehensive healthcare to all its citizens. A wealthy society that doesn't take care of its own. A species that neglects to care for its own kind. That is indeed very rare in the animal kingdom. What kind of statement does that make for America? Healthcare needs to be a top priority in America, yet many of our representatives refuse to make us their top priority, catering instead to the big money from HMOs and the health insurance industry to line their pockets and campaign coffers with millions in bribes. What else can you call it when these politicians side with the big money interests from the healthcare industry? To be blunt, the current healthcare debate in America is a complete farce, a calculated deception to misinform and mislead the public. The biggest ruse is the public option. They make it seem as though they don't want us to have it, in essence tricking us into believing we should have it. They get us to scream and beg for it so that we think we're getting something that we shouldn't have. This is nothing more than psychological warfare. The Republicans and Blue Dogs want Americans to believe the insurance industry doesn't want a public option. But truth be told, even though the public option may be government regulated to feature a lower cost, it still delivers 46 million new customers to the insurance industry to profit from. A huge win for the insurance industry. What they don't want is a nonprofit single-payer system. All you hear from right-wing Republicans and Blue Dog conservative Democrats is that healthcare reform will put the insurance industry out of business. Since when are we more interested in helping the trillion-dollar health insurance industry? This certainly shows the allegiance for many on the conservative right. These same people scream that a single-payer plan or public option is socialism. Their false accusation is nonsense in a healthcare debate, since these same people don't seem to realize our country already freely embraces many beneficial social programs, such as the police department, the fire department, the post office, libraries, public schools, public transportation, Social Security, Medicare, the highway department, our judicial system, our public parks, our city sewer systems, our garbage dumps. Even our United States military is a government service. Hopefully you're starting to get the picture about the benefits of social programs. Healthcare should be a free social service. Anything less is demeaning to a civilized society. You see, the key here is we've all been sold a false bill of goods when it comes to defining socialism. It's been in the corporate private sector's best interest to get us all to think of socialism as an evil, bad thing. They want us to think that so that we don't get in the way of the rich getting richer. They don't want us to upset their trillion-dollar for-profit healthcare industry. As long as their CEOs can keep denying Americans healthcare coverage because of pre-existing conditions, they get to keep their multi-million-dollar salaries and the hundreds of millions in executive bonuses. It's in their best interest to keep this rigged game playing out just the way it is. Fundamentalist Christian conservatives need to ask themselves but one question. What would Jesus do? Would he care only for the rich and the corporate bottom line, or would he care for the poor and the sick? The truth is, Jesus would care for everyone, because that's what good socialism is all about, caring for the many rather than a privileged few. Socialism is nothing more than a derivation of the word society, caring for everyone. House Resolution 676, the Conyers-Kucinich bill, would benefit everyone. The poor, the middle class, and the rich. All Americans. The only thing the rich won't get from H.R. 676 is richer. H.R. 676 will cut out the health insurance middleman and 1/3 of our health care expense. Our government of the people, by the people, and for the people would operate our health insurance as a nonprofit entity. They pay the bills and their administration costs, but with no profit. That's hundreds of millions in savings per year. No more bankruptcies due to outrageous medical bills. No more people dying just because they can't afford health care. A better system with a better way of life for all Americans. H.R. 676, the Conyers-Kucinich bill, is endorsed by more than 14,000 doctors. Don't believe the talk show pundits when they say we can't have it either. Call your elected representatives now and state your desire for a single-payer plan. H.R. 676. Tell them it's the right thing for America. When we the people speak together, it's a voice too loud to ignore. Single-payer plan H.R. 676 is the best plan for America.